So as a provider, often we'll think about first the patient, and we want to decide how severe is the condition in terms of the arthritis, how long have the symptoms been there, how bad is the arthritis. So we start by using our most basic medications, something like an anti-inflammatory, mild anti-inflammatory like Aleve or ibuprofen even, and those we might reserve for patients who have lesser symptoms. And then we again will go stepwise. So if indeed the patient has more severe symptoms, we might go down to the next medication, which might be something like methotrexate. And then the next step would be something like our anti-TNF medications or our biologic medications. So it really does depend a lot on the patient presentation and the patient's symptoms and their quality of life and how severe the disease is. And so when we're thinking about the shot form versus the pill form or the liquid form, the shot form we know gets completely or entirely absorbed in the patient's body. So we know that 100% of the medicine that we ask the patient to give will get into their body and in their system. Unfortunately, with the pill or a liquid, when it's taken by mouth, some of that medication might be disrupted when it gets into the stomach, and then the acid juices are flowing, and so we're not confident that all of the medication gets into the system. But really, if a patient isn't very severely affected, or they're not so limited or suffering from a lot of pain, and there is time based on the type of disease, then sometimes we'll still try the oral form just to give the patient a chance to see if they might respond before switching to the shot form if it doesn't work. So the role of a patient or a parent in choosing medications is significant. So this is a shared decision-making process between a doctor and a patient and their families, mostly because it's not the doctor who has to go home and take the medication or give the medication. It's really the child and the parents or the family. And so it's really important that a patient and parent understand why they're taking the medication. However, when we're speaking about arthritis, often there are a few options, one or two, and so it's a long discussion that should be had between your physician or provider and the family in terms of deciding what works best for their lifestyle.